Hello, my name is Shrini Bascom. My mentor is Dr. Judith Kreider, and this is my presentation on a search for advancements in the diagnosis and detection of feline immunodeficiency virus, or FIV. Before diving in, I just wanted to mention my reason for selecting this topic relates to my personal interest in the veterinary medicine world and my goal towards becoming a veterinarian in the future. I currently work in the medical field, and FIV is something I see often in the clinic I work for. Although the disease is not transmissible to humans, I feel it's still important to understand and care about in a veterinary perspective. Like any virus that affects humans, it's important to manage and control the spread of feline viruses for the safety of your own and the cats of others. Knowing the status of your cat will help yourself in making important veterinary decisions in your cat's medical care. Even if you don't own cats, I believe the virus is still worth studying and understanding due to its similarities to the human immunodeficiency virus, or HIV. So what is FIV? FIV is an RNA envelope virus belonging to the genus lentivirus. It affects the domestic cat and its wild relatives. Like other retroviruses, it is a three-layered structure composed of an innermost genome nucleocaspid complex with helical symmetry, and a casohedral caspid, and an envelope with glycoprotein spikes. When the virus finds a cell, receptors help it bind to and fuse with the nuclear membrane of the host cell and bring it into the cytoplasm, where copies of the viral genome are made. Here to the left, I have a diagram showing off these steps from the fusing of a new virus or an old virus, the replication steps, and the exit of a new virion particle. FIV is primarily transmitted through deep bite wounds. Older male cats that are allowed to roam are known for being the main carriers of disease as they are more aggressive and prone to fight. Although not documented in cats naturally, transplacental transmission, transmission through parturition, transmission through nursing, and venereal transmission are all possible. After infection, the immune system of the cat is targeted, leading to progressive and persistent immunosuppression that increases susceptibility to secondary infections and chronic disease. The infection has several stages from acute to progressive, but severity can depend on the cat's environment and access to veterinary care. Common symptoms are fever, weight loss, anemia, stomatitis, recurring respiratory infections, inappetence, and persisting wounds. Traditionally, diagnosing FIV involves the use of an ELISA and Western blot technology tests that detect antibodies against the virus in blood samples. Although ELISA and Western blot tests are rapid and simple, false positives do occur in some groups of cats that aren't necessarily carrying the virus. For example, kittens that carry antibodies to the virus from nursing on an FIV positive mom, or in cats that have received a vaccine against FIV. Additionally, blood collection can be very stressful for patients, especially in high-volume shelters where screening is required for cats with ambiguous history. Venipuncture is painful and can lead to fearful behaviors during future vet visits, which isn't pleasant for the cat or veterinary staff. Therefore, my research question asks, what are the current advancements in FIV detection, and are there more effective and less invasive methods for detecting FIV in our feline patients? The first of the three studies I'd like to present is a study done by Xiong and collaborators. In their study, they evaluated the performance of a commercial point-of-care FIV test, or called Rapid Status FIV, for cats in Australia. In countries where the FIV vaccine is used, there's a need for differentiation between cats naturally infected with and cats that have been vaccinated against FIV. This was a two-part experiment that looked at the test's ability to distinguish between cats of known FIV status and known FIV vaccination status, and cats vaccinated annually against the vaccine, and cats that received a primary FIV vaccination. In this study, the specificity and the sensitivity of the test was used to measure performance in distinguishing true negatives and true positives. Sensitivity is measuring a test's ability to correctly identify those with the disease, while specificity measures the ability of the test to correctly identify those without the disease. In the case of this study, the sensitivity and the specificity were both high, with an accuracy of 98.8 to 100%. Establishing this POC kit as a DIVA, or a differentiating infected from vaccinated animals. And to the left here, I have a couple of diagrams demonstrating or indicating the results of these tests. The top one being the results of the FIV status FIV kit test in comparison to the known FIV infection status. The second one on the bottom is comparing the number of days taken for a false negative to occur, if it did occur, depending on if a cat was vaccinated annually or if it received a primary FIV vaccination. The second study I would like to present is a study done by Xiang and others. In this study, their goal was to develop a one-pot loop mediated isothermal amplification process integrated with neutral red, or an NR lamp study, assay for the detection of FIV proviral DNA. Unlike antibody tests that can give false positive, this method detects FIV's genetic material by directly targeting the GAG gene present in the virus. The reaction is performed in a single tube at a constant temperature, and positive samples turn pink while negative samples stay yellow, making results easy to interpret without specialized equipment, which can also be seen in the figure at the top here on the left, and the time taken to see that result. The researchers also wanted to validate the test using standard DNA, comparing other feline viruses to confirm specificity, and 80 clinical blood samples taken from cats. When compared to the PCR, the current gold standard molecular method, NR lamp showed high sensitivity and specificity, shown in the table in the bottom left corner here. It also has a kappa value of about 0.96, indicating an almost perfect agreement. Overall, the study shows that NR lamp is a practical, accurate, and user-friendly tool for detecting FIV. The last study I'd like to present is an experiment done by Green and collaborators. The study evaluated whether saliva can be replaced or whether blood can be replaced by saliva for diagnosing cats using the antigen rapid point of care test. Researchers used 382 cats from different settings, such as shelters, clinics, teaching hospitals from different regions in Australia. Saliva was collected by gently swabbing both cheeks, then applying it directly to the test kit well with buffer. Compared to the gold standard blood test, the saliva testing showed a sensitivity of 84.2%, meaning that it did miss some infected cats, but a specificity of 100%, meaning there were no false positives. Nine cats were FIV positive by blood but tested negative in saliva. The study also identified that male cats and those in poor health were more likely to be FIV positive, despite being slightly less sensitive than blood-based methods. The saliva-based method is inexpensive, minimally invasive, and practical, particularly for shelter screening. The author suggests that it's a viable first-line test, with confirmatory blood testing being required when there was reasonable concern for infection in a cat. And here, I just want to show a comparison of all the studies I found and their contributions. And the two studies I wasn't able to cover due to time restraints. One of the two studies I wasn't able to fully cover was the RAM assay, done by Sawana Shode and collaborators, in which they studied the performance of a hybrid molecular amplification test. It offered a higher accuracy than ICA tests. It is faster, cheaper than PCRs, and is more portable, which is suitable for shelters and low-resource hospitals. The limitations of this test do include a lowered sensitivity compared to PCR and occasional false negatives with samples with low viral load, and unfortunately does still require a blood sample. The second study here, done by Ferrero and others, analyzes the efficiency of a new laboratory ELISA called the FifCheck AB ELISA, which offers rapid results and high precision for clinical use. Unfortunately, the test can't distinguish between vaccinated and naturally infected cats, and does also require a blood sample for use. Across the 5 diagnostic technologies evaluated today, there is a clear pattern of rapid advancement towards a more accurate, practical, and context-appropriate FIV testing. FIV status stands out as a major clinical breakthrough by reliably distinguishing between distinguishing vaccinated cats and naturally infected cats, solving a long-standing issue in FIV serology and improving confidence in point-of-care decision-making. Molecular innovations, such as the neutral red-based lamp assay and the RAM method, further expand on diagnostic options by providing PCR-level detection of viral DNA with less equipment, enabling fast, affordable testing in shelters, field settings, and low-resource clinics. The FIV-AB check ELISA adds a strong laboratory tool with excellent sensitivity and specificity useful for high, thorough output or confirmatory testing. Finally, the antigen rapid saliva test introduces a genuine low-stress, non-invasive screening method, particularly valuable for shelters, even though its reduced sensitivity requires confirmatory testing in special cases. Together, these tests demonstrate how FIV diagnostics are evolving towards a greater accuracy, accessibility, and animal welfare. and allowing clinicians to choose the most appropriate method based on patient needs, available resources, and required diagnostic testing and certainty. So to summarize, though significant progress has been made towards the diagnosis or improving the diagnosis and detection for FIV, several challenges still remain, particularly with the lack of truly non-invasive and DIVA-compatible tests that can accurately distinguish FIV vaccinated and FIV positive cats that were naturally infected without compromising sensitivity or specificity. Currently, saliva-based diagnostics show the most promising results, but they do require further biomarker testing and detection to reduce the false negatives. Another priority should be the integration of molecular and serological testing methods capable of detecting viral nucleic acids and antibodies into dual modality kits. This would provide more rapid confirmation of infection status while reducing invasive sampling methods. And with that, that does conclude my presentation. Thank you so much for listening.